Menstruation is the bleeding that happens cyclically in every woman once they start menstruating. A normal menstruation has a range. When you get your periods between 25 to 35 days, it's a normal duration. If your period lasts from 3 to 7 days, it's a normal menstruation. If there is mild discomfort, mild pain, not controlling your lifestyle or disturbing your lifestyle, then this is normal. If you have periods that come as early before 25 days or coming later than 35 days, a period either which lasts for a very long duration, more than 7 days, or lasts for a normal duration but the flow is extremely heavy along with passing of lot of clots, or if your menstrual cycle is extremely painful wherein your normal lifestyle is disturbed, you might need to take a break from your school, college or work, then this is abnormal menstruation. In India, when women have heavy excessive menstrual bleeding, generally it's considered good. It is believed that all the impurities and the bad blood, if it is thrown out, it is good for body and health. This in fact is a myth. More than normal bleeding can give rise to lowering of your hemoglobin, anemia, fatigue and lack of concentration. So if you are having very heavy menstrual cycle, a gynaecologist consult is a must. Your healthcare provider will decide after listening to your detailed history on menstruation whether you need an ultrasound or not. Women heavy menstruation could be suffering from fibroids, could be suffering from thickening of the wall of uterus known as adenomyosis, could be suffering from polyps in the uterus, could be suffering from some tumor in the uterus, could be suffering from cyst in the ovary, could be suffering from some cancerous tumors of the ovary, could be suffering from thyroid, could be suffering from any other hormonal imbalance which are connected to the ovaries. These are so many reasons which can give rise to heavy menstrual bleeding. If you are diagnosed with any of the problems that I discussed, you need to be specifically treated for that. If none of the above problems are diagnosed, then a woman is stand to have DUB, which is dysfunctional uterine bleeding, happening due to disturbance in the hormones. When we diagnose such a case, we recommend a course of hormone therapy to regularize your menstrual cycle. In India, there is a lot of resistance to taking hormonal therapy because there is this thought that all hormones are bad. In fact, the hormonal therapy that we give to a woman will make her menstrual cycle and her hormonal balance better. These therapies are ideally given for around 3 to 6 months. They are not permanent and they have no side effects if prescribed by the correct person, given in a correct dose and taken in the proper way. When your young girl starts her menstruation, that is a sign that the changes in her body has begun. If there is any major issue with menstruation in terms of amount, frequency or pain, it is a time to see a gynecologist. If she has no issues, then before she becomes an adult, we would recommend a consultation with a gynecologist so that you are up to date on her vaccination like the cervical cancer vaccine, the rubella vaccine. Also, by consulting the gynecologist, she would make sure that her menstruation and her menstrual cycle is on point, whether she needs any supplements to make her better, and most important, if you make her meet the obstetrician gynecologist, many myths surrounding the menstruation and the activities that they should be doing, the hygiene part of menstruation are clear, and she can also understand and accept that this is a normal transition in life, nothing to be scared about.